This is part 2 of our lower extremity joint anatomy. Here we will learn the anatomy of the knee joint. Begin a table to denote key points of knee anatomy. Denote that the knee comprises a condylar synovial joint between the femur and tibia, a saddle joint or hinged joint between the patella and femur. These joints allow knee flexion, during which some gliding and rotation occurs, and knee extension, which results in medial rotation of the femur on the tibia. Denote that as a synovial joint, the knee is partially encased in a thin, weak, fibrous capsule that comprises an external fibrous layer and an inner synovial membrane. We'll begin with the superficial structures of the anterior knee. First, draw the femur, tibia, fibula, and patella. Indicate medial lateral in our diagram. Now show that the patella, the largest sesamoid bone in the body, is encased in connective tissue. Indicate that the patellar tendon, or tendon of quadriceps femoris, envelops and extends superiorly from the patella. Indicate that the patellar ligament extends inferiorly from the patella to the tibial tuberosity. We commonly incorporate the patellar reflex into our clinical neurologic exam. The patellar reflex involves a tap of the patellar ligament, which elicits knee extension. Now show that the iliotibial band, or IT band, extends inferiorly along the femur and attaches to the lateral aspect of the tibia to provide structural support to the knee. On the medial aspect of the tibia, draw the pes anserinus, which is the collective tendinous insertion of semitendinosus, gracilis, and sartorius on the tibia. They provide additional stabilization of the medial aspect of the knee. Next, draw the extracapsular collateral ligaments, the medial collateral ligament, or MCL, from the medial aspect of the femur to the medial aspect of the tibia, the lateral collateral ligament, also known as LCL, from the lateral aspect of the femur to the lateral aspect of the fibula. These ligaments arise from the fibrous layer of the articular capsule and maintain alignment between the upper and lower leg bones. Now denote the following clinically important information. Genu valgum, also known as knock knee, is when the tibia is angled laterally. It may result from collapse of the lateral aspect of the knee and tearing of the medial collateral ligament. Genu varum, also known as bow leg, is when the tibia is angled medially. It may result from collapse of the medial aspect of the knee and tearing of the lateral collateral ligament. Now we'll draw the 5 major patellar bursa, which are fluid-filled sacs that provide cushioning and allow for smooth movement of the bones. Several bursa surround the knee, but here we will only describe the major 5. Denote that bursitis, a common clinical condition, involves inflammation and swelling of the joint bursa. First, show the suprapatellar bursa, which is located deep to the patellar tendon. It is clinically important to realize that this large bursa is continuous with the knee joint, because this anatomical continuity allows spread of infection from the bursa to the joint. Next, show the prepatellar bursa, which lies superficial to the patella. Then draw the 2 infrapatellar bursa as follows. The subcutaneous infrapatellar bursa, which overlies the patellar ligament, the deep infrapatellar bursa, which lies deep to the patellar ligament. Lastly, show that the anserine bursa lies between the tibial or medial collateral ligament and the pes anserinus. Now we'll learn features of the posterior knee. Define medial and lateral in our diagram. Again, draw the femur, tibia, and fibula. Now show that the joint capsule spans from the condyles of the femur to the condyles of the tibia. Next, draw the medial collateral ligament, then the lateral collateral ligament. Now draw the tendons of popliteus as the muscle arises from the lateral condyle of the femur and inserts on the medial aspect of the proximal tibia. Next, draw the arcuate popliteal ligament, which arises from the fibular head, arches over popliteus, and then merges with the posterior articular capsule. Lastly, draw the oblique popliteal ligament, which is an extension of the semimembranosus tendon that blends with the posterior joint capsule. Finally, let's draw the anatomy of the deep structures of the knee in anterior view. First, define medial and lateral. Now draw the femur, tibia, and fibula. Then draw the transverse ligament. Its precise function is uncertain and its presence is variable. Next, draw the menisci. First, the lateral meniscus, then the medial meniscus. Menisci are plates of fibrocartilage that attach to the articular surfaces of the tibia. They aid in shock absorption and lubricate the joint. They lie outside of the synovial cavity, but within the joint capsule. Next, draw the medial collateral ligament, then the lateral collateral ligament. The medial meniscus attaches to the medial collateral ligament, which makes it more vulnerable to injury than the lateral meniscus. Now we'll draw the cruciate ligaments, which lie outside the synovial cavity, but inside the knee joint capsule, and prevent anterior-posterior sliding between the femur and tibia. First, draw the posterior cruciate ligament, or PCL, which arises from the posterior intercondylar area of the tibia and passes superiorly, anteriorly, and medially to attach to the lateral surface of the medial femoral condyle. Then draw the anterior cruciate ligament, or ACL, which arises from the anterior intercondylar area of the tibia and passes superiorly and posteriorly to insert on the medial surface of the lateral femoral condyle. Now denote the clinically important physical exam findings of cruciate ligament rupture, called posterior and anterior drawer signs. The posterior drawer sign occurs in the setting of PCL rupture. The tibia slides backwards on the femur. The anterior drawer sign occurs in the setting of ACL rupture. The tibia slides forwards on the femur. A segment of the patellar ligament can be used to repair the anterior cruciate ligament. Now denote the following additional clinically relevant forms of knee injury. The unhappy triad involves injury to the tibial collateral ligament, anterior cruciate ligament, and medial meniscus. A popliteal or Baker's cyst is a common cause of painful swelling behind the knee, which results from knee arthritis, meniscus injury, or tear of the joint capsule. This concludes our diagram.